segment is the older adult in? Ego, integrity versus despair. What does the older adult often lose? Um, like dignity and self-esteem. Period. Okay, what can result if coping is not good in the elderly? Depression. Okay. Now, if you guys went through the handout that Krista posted, that's where I got those questions from. Or I tried to turn the information into questions. Now I'm going to go through flashcards. Some of them. Okay, this is partial thickness. Involves epidermis, endermis, abrasions, or blisters. What stage? Stage 2. Another word for farsightedness. Presbyopia. When the tissues near skin surface have low O2 saturation. Cyanosis. An abnormal condition of the vertebral column characterized by increased convexity and the curvature of the thoracic spine. Kyphosis. Age spots. Lentigo. A slowly progressive organic mental disorder characterized by chronic personality disintegration, deterioration of intellectual capacity and function, and memory loss that leads to confusion, disorientation, and stupor. Dementia. Excessive urination at night. Nocturia. Difficulty swallowing. Dysphagia. A normal loss of hearing acuity, speech intelligibility, auditory threshold, and pitch associated with aging. Presbycusis. An acute organic mental disorder characterized by confusion, disorientation, clouding of consciousness, incoherence, fear, anxiety, excitement, and often illusions and hallucinations. Delirium. Abnormal neurologic condition in which language function is defective or absent because of an injury to certain areas of the cerebral cortex. Abnormal neurologic condition in which language function is defective or absent because of an injury to certain areas of the cerebral cortex. Aphasia. What pressure source has a wound vac? Stage 4. Full thickness involves necrosis of subcutaneous tissue, a deep crater with or without adjacent tissue. Stage 3. Mucus buildup. Bacterial moves in and causes pneumonia. What condition is this? Atelectasis. Atelectasis. How do you treat renal calculi? Encourage fluids, 8 ounces every 2 hours if they're not restricted. High abdominal incision, not taking in deep breaths, and lungs not in use. So it results in the lungs filling with mucus. Is a cause for Atelectasis. Full thickness tissue loss with wound base covered by slough or eschar. Unstageable. Full thickness skin loss with extensive damage to muscle, bone, or supporting structures. Muscle, bone, or supporting structures. Stage 4. What's another word for sundowner syndrome? What's another word for sundowner syndrome? Nocturnal delirium. Nocturnal delirium. Stroke, tumor, systemic infection, fluid and electrolyte imbalance, and drug reaction can cause delirium. Interruption in sleep and recent relocation can cause sundowner syndrome. Symptoms of this disorder or disease are of short duration and are reversible with treatment of underlying cause. Delirium. So when I think of delirium, I think of like patients with UTIs, elderly patients with UTIs, and they be confused. Okay. Which disease process of the elderly has 3 stages? Alzheimer's disease. Brain atrophy, enlarged ventricles, neurofibrillary tangles are characteristics of Alzheimer's disease.